Hi friends, we are demonstrating pitch patch augmentation for massive rotator cuff repair. Here we have taken triple loaded anchor in the front or the medial aspect and triple loaded anchor likewise in the back or the medial. So both triple loaded anchors, two anchors in the medial just lateral to the articular surface is now deployed and sutures are passed over the rotator cuff. We will get three pairs in the front and three pairs in the back. In that three pairs, after we made the sliding knots on the rotator cuff, one pair, that is black tiger, is kept without taking to the lateral row anchor, and one pair of white is also not taken in the lateral row fixation. This is a lateral row fixation which is being made now with the two pairs front and two pairs back with the crossing of the threads. You can see there is this uncovering of the rotator cuff or the rotator cuff footprint, and the white thread which is left in the front is used to fix the anterior part of the patch. For the picture, you can see the white thread is seen now in the front. This is going to help us to fix the eyelet of the patch in the front and medial part. Likewise, black tiger in the back and medial part. This is the white color now thread left anteriorly. After we put the lateral row anchor, we should not cut the lateral row eyelet thread, that is a sliding thread from the both lateral row anchors, anterior and posterior, which will help to fix the lateral row of the patch with a sliding knot. For the understanding of the patch, the threads which are passed in the patch, please see the picture shown below with this video. That will help us to understand which are the two threads over the medial and which are the two threads over the lateral. As this pitch patch is now used along with the two lateral row anchors, we are not going to use any extra anchors or any extra implants for this fixation of this pitch patch. We are using the threads of the medial row anchor, two pairs front, one pair front and one pair back for the medial side, and two threads over the lateral side for the attachment. So we are using each corner one pair of the threads. Here, after unfolding, this unfolding is made with the help of suture retriever and knot pusher. We have to push the knot and then we will find out which thread is going to be where. Since this is not like a spring kind which will spread on the rotator cuff, we have to make sure that we are going to be uh, spreading this without entangling the threads and without getting confused with the threads. So here you are seeing medial side, black is behind and white is front. So we have made the knot over the back medial posterior, and now medial anterior is now made with the white color thread, simple knot, so which is going to fix this patch medially on the rotator cuff tendon, repair rotator cuff at the level of the medial row of the anchor. After that, once both the medial side stitches threads are tied, we will come to lateral side, which is the sliding knot, which will help slide the patch nicely laterally, and the patch is going to be snugly fitted, going to be sitting on the lateral row anchor area. So we are not going to use any more new anchors for this purpose in this technique. For that purpose only I have made this video, so that we don't have to put any more anchors. Since this is a standard patch, not a large patch, this will cover most of the shoulders. We don't have to use any new implants. We are now completed this procedure, you can see nicely this patch is covering on the rotator cuff repaired rotator cuff. This is going to give augmentation and healing, increase the healing potential, and going to give the strength for the retear to avoid retears of this uh, already massively torn and retracted rotator cuff. If you have liked this video, please like this. Thank you for watching this video. Please share your comments below. Thank you again.